That tooth got caught with his pants down. I mean, gums down. Do you have any tooth sensitivity or are worried about your receding gums? Today we're going to talk about gum recession. Welcome to my channel, The Gum Dentist. I'm your periodontist, Dr. Alan Wadamina. So if you have recession, the good news is that it's treatable. So why would we want to treat gum recession? Well, gum recession can lead to a lot of different complications of the tooth, including cavities around the root, tooth sensitivity, potentially more bone loss around that tooth, and it can become an aesthetic issue as well. There are multiple ways to treat gum recession, and these include a tissue graft or some other alternative ways or surgical techniques to do it. The question you're probably wondering is, do I need to treat my gum recession? Let's start by talking about gum anatomy or tooth anatomy. We have basically two types of tissue in our mouth. We've got attached tissues or keratinized tissues, and these are kind of like the palms of our hands, the soles of our feet. It's really nice, dense, and thick and protective in nature. The other type of tissue we have is called mucosa. And mucosa is a thinner type of tissue that is not so good at protecting, but it does a great job at allowing our lips to move around. You can tell apart the two different types of tissues by looking really closely at your gums, and sometimes you can see a line that kind of goes across underneath the gum line. Mucosa, you can see the blood vessels a lot clearer, and the attached tissues or keratinized tissues are going to be denser and whiter looking. If the recession in your mouth extends past that line that separates the mucosa and the attached tissues, then you'll likely have to get it treated. Mainly because you've kind of worn through, or the recession has worn through that thick, dense tissue, and we really want to make sure we get back that dense tissue because we don't want that recession to accelerate faster. Gum recession is treated surgically. We can use your own tissue or we can use donated tissue. If we want to try and cover that root, the gold standard technique is called the connective tissue graft. In this case, we take tissue from the roof of the mouth, but we're kind of taking just the inside layers only. So it's like taking a letter out of an envelope. We're taking the inside layers only, and we close the envelope back up. The other option, if you want to cover that root up, is donated tissue. Donated tissue, it works really well as well, and the big benefit of using it is that you'll only have one area where you're going to be sore after the surgery. So what's the success rate of surgery? The success rates of connective tissue grafts or donated tissue are quite good. Studies show that you should get about an average of 75% of that root covered. Now that doesn't mean it's impossible to get 100%, but typically about 60 to 80% of cases get 100%, and the rest of the cases might get somewhere around 50. Again, it all depends on how much tissue you have around there, how thick your tissues are, how much bone you have and blood supply. When I do surgery, typically I pull those tissues up and cover up that root as high as I can. I let that heal, and as time goes on during the healing process, those gums are going to slowly drop into a level that is good for them based on what is supplied by your body. So that's pretty much where your body wants that gum tissue level to be. So I can never guarantee that we're going to get 100% of that root covered. What I can guarantee is that those tissues are going to be a lot thicker. That way the recession is not going to continue. The other question is, what if you don't treat it? Studies have found that if you don't treat it, most of them get worse over time. Now, recession isn't this really quick moving thing unless you bite into something, you traumatize your gums. Typically, it's something that kind of progresses slowly over time, over years. And so if you don't treat it today, it's not like it's a true emergency. But what I'd suggest is probably making sure you treat it sooner rather than later, just because the longer you wait to treat recession, the harder it is to treat. The results are a lot more predictable when I'm treating an area of small recession versus a big recession. Thank you so much for watching. If you have any questions about gum grafting or gum recession, make sure you leave them in the comments. If you liked the video, then hit that like button and subscribe down below. I'll see you next time.